A warm welcome to all the participants and dignitaries. Professor Lalmasai and eminent speakers, shall we begin the program now?
Yes, we can start the program.
Yeah, thank you so much. Once again, a warm welcome to all the participants, eminent speakers. This is the webinar being organized by Child-Centric Disaster Risk Reduction Center, National Institute of Disaster Management, in association with Mizoram Central University, Aizawl. The webinar is on safety of children after reopening the schools. Right, and we all know that COVID-19 is an unprecedented situation, and especially the children and all the people who are facing a lot of issues, and the education is being disrupted for the children. And now slowly many states have started reopening the schools, but after reopening also the number of infection among the children has been increased. The number of children infected is being increased, though the education ministry has given a standard operating procedure, and all the schools were trying to follow, but still the number of cases are also being increased. So this is the webinar organized to find out certain strategies and system to ensure the safety of the children after reopening of the schools. So with this warm background, now it's my privilege to introduce Professor Santosh Kumar, Professor and Head, Governance Inclusive Disaster Risk Reduction Center, and also Professor and Head, Child-Centric Disaster Risk Reduction Center. And he has served as the Executive Director for National Institute of Disaster Management, and he was also a Director for SARC Disaster Management Center, and he was trained in the field of disaster management at Israel. And he served more than 3 decades in the field of disaster management, and he's a well-known, renowned professor, and he's a motivation behind us to organize a huge number of webinars and online training programs. With this brief introduction, over to Professor Santosh Kumar, sir.
Thank you, Dr. Balu, for giving me this opportunity and also introducing me to all the distinguished participants. And this particular webinar, which we are having it with the Aizawl Central University and Meghalaya Central University at Aizawl. And we are indeed grateful to them as well for this being partnership, joint workshop. And I see also that Delhi University, their resource person from there. So this is a good initiative for understanding the challenges of reopening the schools. Because we are talking about the child-centric DRR, so our concern is to start looking at this age group from the play group to the kind of secondary or higher secondary +2 students. And all these students have their differential challenges, differential vulnerabilities, different requirements, different capacities. So how this, like the children are not a very homogeneous group. In the same way, it's not very homogeneous. They have differential capacity, they have different set of administrative structure, they have a different kind of infrastructure of their schools, they have their different resources to cope with this kind of a COVID-19. But one thing is in common, that everywhere the children are there and they are coming to the school. So in the second surge, which we say that which is coming as a spike, as a wave, that it has come again, and COVID-19 is spreading. Most of the cities we are now finding that after the reopening, city when it got this reopened, then probably we felt that COVID problem is not there. In fact, this kind of opening and reopening required our more kind of this mature behavior in terms of visiting the places or in terms of going to these schools or managing these schools and so on and so forth. So first and foremost, which I always say that security and opening up the school would bring from home to home safety. And home to home safety, meaning thereby when the children they reach school, they have a different mechanism to reach. Somebody is coming by school bus, somebody is coming with the local rickshaw, somebody is coming with the auto, and somebody is coming by foot. So many, depending on the distances and their affordability, children are accessing school. So in this kind of a parameter, that how those who are transporting, I mean, they're engaged in transporting and taking children from one place to the other place, what kind of a protocol they are following in the transport system itself. The handling of the kids while taking them in the bus or bringing them back to the home. Uh, what were the seating arrangements done in the school bus, how children are interacting with them. Because I remember when we used to go in the school bus or during our childhood, we used to jump around in the bus itself and going to from one seat to the another seat and going to one friends to another friends. We look for the window seats and kind of, and then you also fought with our friends during the school age. And that kind of a thing happens when you see the children's psycho and children's behavior. So how to ensure that the transportation itself is very, very kind of a sanitized way of handling where the children are safe, maintaining personal hygiene and all. The second important thing which what Dr. Balu highlighted in terms of when they reach to their school, and school when you are saying that it's a heterogeneous, not a monolithic category. So in this heterogeneity, what kind of arrangements which we have been able to make, how our staff are trained to handle children, how our teachers are actually being trained to handle the sessions during the COVID time, and also making themselves kind of accessible and also not accessible to the children because the distance to maintain. So all these things, and then we also look at that hand washing is another thing which is very, very important. So whether the toilets and the of the schools, how that is managed, what is the capacity of that to handle such kind of a situation, whether the personal hygiene has been taken care of. Because day to day also when the school struggles for the cleanliness, they look at this, it should be kept in order, how should be kept in order. But what happens, even the slightest of the slackness, that makes the life miserable. So in this context, Dr. Balu highlighted that children went to their school and they got affected. So that we never know which from what kind of a mechanism school is going to have now. The protocol, as he said, that issued a protocol to follow when we are opening the school. So we are going to reduce so that the pressure on the infrastructure is not there. Whether the school is having also a kind of a blended learning system where those children who are willing, parents who are willing to send their children, they can send, and those who are not willing to facilities, whether possible to the school or not. It may happen in outside India or in Europe or America, but whether this schools in the Nagar Nigam school, village school, city schools, private school, government schools. So how they are coping with it, and what kind of which we said as a minimum non-negotiable things are actually taken care of. So this is the things which we are concerned about, that how the children, the confidence of the parents are there, and parents also taking care of, so that they should not affect other children. If they know that their family is affected, they should not be sending their children to the school. So how these education will go, we are seeing this every day, that when people are saying, don't, please put up the mask, wash your hands, have the social distancing. but we keep seeing dichotomy in the visual mode, especially on the television. We see and children also see, and that they get the deep imprinted in the minds of their children. Somebody is without around, so that children think that also that probably the COVID system is also why I should wear the mask. So those kind of challenges the school administration do have. So I will not say much now. I have taken a lot of time here today in the opening, especially the concerns with the child-centric disaster risk reduction have. So idea is to discuss threadbare. Some of the international examples could also be brought in here, so that the government of India's guidelines and how these two can be combined, which is pragmatic also to execute and should not and that kind of guidelines to the parents, to the teachers, to the students, and also those transporters who are handling the school and at school. So all together, so that collectively we may think that reopening of school could be possible if or without affecting children further. With this, I would request, and once again, I would like to extend my heartfelt thanks to the university and also to all the resource persons and the participants who have joined us. I'm expecting a very good deliberations because the insights would come and then probably we all will be benefited. So thank you very much, Dr. Balu and your team and Dr. Ranjan, and on behalf of Major General Bindal also extend my heartfelt thanks to all of you. He has some personal work, so he's not here today. So I extend my greetings from him to all of you. Thank you very much.
Thank you, Professor Sir, for giving a brief background about the webinar and what the deliberations required and how the children were being infected after reopening of the school. It has given a light to the this webinar. With your permission, I move to the next step. Now, supposed to join Vice Chancellor of Mizoram Central University, but he has some appointment with the doctor, so he has conveyed to us his congratulations, but he's not able to join. He may try to join in the valedictory. Now I hand over to Professor Lal Masai, UGC Director, the Training Center, to introduce the eminent speakers now. Over to you, ma'am.
Okay. Thank you. Good afternoon, everyone. Okay, Dr. Balu, moderator of this program, Professor Santosh Kumar, Professor Pankaj Arora, Professor Jesse Abraham, and all the participants. You know, this is the second time that NIDM, Ministry of Home Affairs, Government of India, and Mizoram University jointly organized programs. And the first one was in September. It was a 3-day online training program. And this time, I was given the responsibility to identify resource persons. And Professor Pankaj Arora and Professor Jesse Abraham, who had once been resource persons in the programs organized by our university, came to my mind instantly. So when I talked to them, both of them accepted my invitation. I'm very, very thankful to them for accepting our invitation. Now, due to time constraint, I will introduce them as brief as possible. Professor Pankaj Arora is Director, Institute of Lifelong Learning, University of Delhi, and Professor of Education, CIE, Department of Education, University of Delhi. Now, apart from presentations and publications of research papers, Professor Arora has 5 books and 1 edited book to his credit. He has delivered a good number of keynote addresses, inaugural addresses, speeches for various webinars, workshops, faculty development programs on different aspects of NEP 2020, organized by more than 13 universities in the country. He has written newspaper editorials on NEP 2020 in different newspapers. Now, some of his important assignments outside his university include his visitor nominee to the Executive Council of Central University of Gujarat, Gandhinagar, since 2016. His mentor, School of Education, Central University of Gujarat, Gandhinagar, since the inception of the school. Member various committees at NCTE, NCRT, ICSSR, SCRT, and different central and state universities. He is also a member of academic team in various publication houses such as the Journal of International Teacher Education and Teaching, Chicago, Illinois, USA, Education India, the e-journal, then part of reviewer committee, Routledge, Taylor and Francis Group, European Journal of Social Sciences, UK, Journal of Education and Human Development, American Research Institute for Policy Development, USA, and many more. Professor Arora has led various major and minor research projects funded by UGC, ICSSR, and University of Delhi. Recently, he has been chosen for National Education Day Award 2019, Shikshak Kalyan, Samagra, ALTTC, BSNL, New Delhi. Now, our next resource person will be Professor Jessie Abraham. She is Professor, Department of Teachers and Non-Formal Education, IASE, Jamia Millia Islamia, New Delhi. Now, prior to this, Professor Jessie Abraham taught at Lady Irwin College affiliated to Delhi University, then DPSIHE affiliated to GGSIPU. Then her fields of specialization include educational psychology, educational technology, ICT, guidance and counseling, home science education, and early childhood care education. Now, she received JRF and SRF from EGC while pursuing PhD. Intel's National Award in 2004 for Integration of Technology, Merit Scholarship, and World's Memorial Medal in 1991 from University of Kerala. Now, with regard to publications, she has 37 journal articles, 6 books, 40 chapters, including modules for distance education published. She has reviewed a number of articles and edited research journals. She has delivered several invited talks, chaired many sessions in conferences, acted as an expert in several panel discussions, acted as resource person in many faculty development programs and webinars. Professor Abraham has completed 4 externally funded research projects. Under her guidance, 17 PhDs have been awarded, 8 PhDs are under different stages of completion. Now, Professor Abraham is also the founder, honorary director of Gerda Phillips Bond Day Care Center at Jamia Millia, and for 1 year, Musir Fatima Nursery School. Presently, she is honorary director of schools, evening shift, and bridge course. Okay, so today we are very, very happy to have the 2 resource persons for today's webinar. Okay, I welcome them and I give many, many thanks to them for accepting our invitation to be resource persons for today's webinar. Thank you.
Now I welcome Professor Pankaj Arora to take over the session now, please.
Good afternoon, everybody. In Mijogam University and in Ministry of Home Affairs, Mijogam University, National Institute of Disaster Management. Dr. Balu, for comparing this event so beautifully. Professor Kumar, who has set the agenda for discussions for next 2 hours and presented an overview of the entire scenario. How we are concerned can be easily seen from his address there. while he was talking of heterogeneity in not only among students, but also among institutions. So when we are planning something post-COVID, we need to be very, very careful and cautious in the lines which Professor Santosh has suggested, that institutions are neither homogeneous nor the students, nor the parents. So their resources and their immunity level, their everything is different from each other, the way the world is different from. Yet we all are passing through a difficult phase of our life of 21st century, a corona period, which has confined us to our homes and affected badly, adversely on our economy, on our education system, on our social activities, on our religious activities, and almost all other aspects of human life. I am grateful to Professor Lal Masai for inviting me to this event, because I have been participating in lot more events discussing policy, discussing education in period, discussing how digital education is a mean to promote education during Corona period, post-Corona period. So Professor Lal Masai suggested me the theme of this webinar, which I found very interesting, because this is high time when we all must come out of that sad state of confinement at homes and start thinking. At least mentally we should be getting activated, and mentally we should be opening up, planning the way Government of India is planning how vaccine will reach to the masses, to 130 crore people of the country. Same ways, we, the people of education, must start thinking how should we make sure that our children are safe after reopening of schools. So I want to congratulate Mizoram University and NIDM, Ministry of Home Affairs, Mizoram, for thinking in these lines and organizing this well-meaning webinar today. My co-panelist who is sharing screen with me in this webinar, Professor Jessie Ibrahim, who is a teacher educator like me, and I think she must be discussing on one aspect of schools after Corona, schools after this COVID-19 period. My theme, what I shall be discussing, is well-being, emotional well-being of the children in post-Corona period, when we are suggesting, we are thinking to allow them to schools. So emotional well-being is, to my understanding, is one of the most critical aspect of human life, especially in present time. Present time is a period of competitions, throat cut competitions, unemployment, economic crisis in families, because our economy is very adversely affected during this COVID period. Even the second GDP in last 3 months, July to September, is again minus 7 point something. So our economy is not on the track yet. So this economy statistics is not only a statistics, but a gloomy picture of people's life, how people are planning their day-to-day needs, how they are managing it, and how they are trying to maintain their physical, mental, and emotional health at the same time. So, friends, I will be discussing about emotional well-being of students. We all understand that human personality has multiple aspects of their personality. One is physical, which we all can see, we all can be concerned of. If we got a needle pinch in our body, it pinches because it's pinching on our body, physical aspect. Be safe physically, we should be sound physically, we should not be we should be fit, so we should be following certain guidelines during corona period, maintaining distance, using sanitizers, controlling our outings, yet trying to maintain our physical fitness through yoga, through other indoor activities which we can maintain. Second aspect of human personality is emotional aspect, which doesn't look at which symptom that cannot be seen on my body, but there in my mind, in my emotion, during in my actions, you can see that the way we say body language. Professor Lal Masai is a person of education. She must be appreciating that body language we teachers, Professor Abraham would be in agreement. Through body language, we can read people, whether they are physically fit, they are happy, they are sad, they are going to do something, they are anxious about something, they are terrified, they are overjoyously reacting. So this body language is true representation or prediction of our state of mind, our emotions. Another aspect of personality is social life, our social aspect of our personality. We are confined homes. We are not meeting people. We are not playing them with them in playground. We are not going for morning walks. We are not going for weekend outings to malls and to sports grounds for the children specifically. Then sexual aspect of our personality, which also need to remain healthy. We should be not sick mentality on sexuality. Domestic violence and sexual crime should not increase in this corona period. And last is this important aspect which has emerged in last 8 months in the country, in the world, and that is protection from corona. So we all are passing through this critical phase of almost 10 years, 10 months now, when we are trying to maintain our emotional, social, sexual, as well as corona-related health measures, preventions, and curement. See, if a prisoner, if somebody commits a crime, is sent to jail, what does jail means? Jail means confinement. You are restricted, your movements, your actions, and you are confined to a cell, to a fixed number of, fixed size of room with a limited number of people around you. And we call it a punishment. So confining to jail is a punishment. What are we doing there? We are just withdrawing you from society and confining you to the four boundaries of jail with a limited number of people around you. And law says this is a punishment to an individual. Now, what corona has done? It has confined us for no guilt, no crime of us to our homes with the limited set of people. We are lucky that this limited set of people is not unknown people. They are family, they are relatives, they are close friends, and are there with us. I wanted to repeat my point that this corona has put us into bars for no fault of ours. Now we are planning how can we bring children out of this bar, out of this jail. My 3-4 important suggestions. One, this 8 to 10 months of confinement to home with limited number of people around us has some directly or indirectly impacted our emotions, has given us frustration, has given us screen addiction. We are screen addicts now. It has increased cases of domestic violence, domestic crime within families, economic issues within families. And it needs to, now when we are planning to open schools and allow students to come to schools, we must make sure that we are providing them not only physically healthy environment, but also emotionally healthy environment. How can we do that? For that, we all adults need to prepare mentally. One, we need to be open-minded. The way a person is coming from jail after confinement of 1 year is supposed to party, is supposed to go around, is supposed to go for tourism. Same ways, schools should be a little flexible in their curricular and co-curricular activities. The way Professor Santosh Kumar was suggesting, we all collectively holding hands parents, educators, government machinery, students, media, all need to collectively work for a healthy welcome of students to their classrooms. They are not playing with their peers for more than 10 months. They are not going to grounds. They are controlling themselves through online games with their colleagues, with their friends, with some unknown people as well. We want they should be before their arrival in schools. We must not only physically sanitize, physically make healthy environment in school, but also curricular environment should be healthy. More of activities. Morning assembly is something which student must be missing. Morning PT is something which students are missing. Sports period is something which they are looking forward to come to school, enjoy with their friends, go to playground, jump around, shout around, and do everything nasty, everything nostalgic they want to do. The atmosphere in school should not be evaluation oriented, examination oriented. We have to think of in this period is a unique, unprecedented period in our life. So we should be a little flexible. This unprecedented period has no precedent before it. So we have to set standards. We have to set examples. One state, one institution, another state, one country, another country. All have to set different examples according to their situations, according to the gravity of coronavirus spread in that zone. Like my zone, Delhi, has one of the critical zone for COVID-19. Maximum number of deaths are taking place for last 20 days now. 20% of total deaths in the country are happening in Delhi. So people are losing their near ones, their dear ones, their grandparents in their families, and their parents or siblings who are physically weak, whose immune system is weak. They might have gone through a critical phase during this corona period. So with a healing approach. School should be welcoming with an open mind. School should be allowing students to go for more experimentation. In that way, I am suggesting that they are spending long duration on screen because of their classes and because of their social media, because of their personal thing, which games on social or games on screen. Lot of people are playing online games, etc. We need to take them out of that addiction of screen and take them to the real world where they can feel, they can see, they can enjoy not only soil of the city, soil of the town, soil of the playground, but also greenery all around, healing touch all around, emotionally stable people around them are the need of the time. So what I was suggesting, their homeworks should not be an important consideration when we open. Our teachers should be educated, trained to have flexible pedagogies in their classes. Flexible pedagogies means to the extent it is possible, they should be using outdoor activities. They should be doing group activities. They should be organizing co-curricular activities. And this scholastic assessment should be happening, continuous and comprehensive evaluation should be happening instead of term and examination. So they are not, many of them may not be able to face examination because the moment in February, January will reopen and we announce that in April you will have examination, either board examination or school examination. So we are taking them out from one difficult situation and putting them into another difficult situation. So instead of examination this year, especially for non-board classes, the classes which are not exiting point for school education, class 12, for all other classes, we can plan something which is more flexible and open and creative. This continuous evaluation should be the core of those plannings and those suggestions. More singing, more playing, sports, more group activities, more special assemblies. We need to prepare certain video tutorials from state level, like you can think of that, video tutorials, how to get ready to welcome students in school or colleges. So what are the do's and what are don'ts to reopen institutions? The way Professor Santosh, they need to make sure ample availability of water, sanitization, mask, going to enter a new lifestyle post-corona. Many of us would be taking time emotionally to come out of life. So psychologically, nobody is pretending, nobody is showing off. People may really be very, very scared of coming out of their homes. Many adults, I know, for example, I can cite an example of a friend of mine who is a senior person, elder than me in age, is a professor in a university system. He is under tremendous anxiety. Doctor has suggested next stage would be a stage of depression. So he need to come out of that. How he has went into that stage? One of his younger brother uh, caught COVID-19 and he was hospitalized on oxygen, gradually shifted to ICU, and finally he was cured with the help of plasma therapy. During this entire process of 20 days hospitalization, from isolation to oxygen to ICU to plasma therapy, this friend of mine was not only supporting him but almost closely associated with him emotionally, and because he is elder brother, and personally well-being, his children, his family, everything. Now this all process of so closely going through all these things, he took it to his mind, he took it to his emotions, and he's emotionally, now brother is recovered, brother is back home. Now brother is accompanying him to his college because this friend of mine has gone under tremendous anxiety level, grade 3 anxiety, what doctors are calling. Why? Because his real brother has underwent plasma therapy uh, treatment, and this entire 20 days uh, trauma of the family has impacted his emotions and psyche to such level that he himself has gone emotionally nervous and weak. So if we can cite an example of an adult who is more than 50 years of age, you can easily imagine the state of mind of young children who are also coming from either affected or not affected or badly affected families during Corona period. Multiple reasons, as I stated in the beginning, because of economic conditions, because of social life is becoming a controlled and confined life, as well as because they are missing their peers, their curriculum, their school, their classroom. They are not connecting with the family the way they used to connect with their peers around. So my suggestion, my closing remarks on this would be, this period of Corona in Delhi, government is like no vaccine, no reopening of the schools. This is a line which the Deputy Chief Minister of Delhi, who is Education Minister also, is thinking around. Because in school, when you allow students to come in, you cannot think that they will not mingle amongst themselves. You cannot expect them not sharing tiffins amongst themselves. You cannot think that be maintaining do gaj ki duri, etc. So no vaccine, no schools is an option. If we are planning to open school for the exiting class levels, as I suggested, class 12, then at the same time, we do not want to declare it a 0 year, because 0 year will again impact economy of families and young students' life to a baddest way. We have just seen the example. Yesterday was Purnima Snan in Haridwar. Government of UP has barricaded highway to Haridwar from Meerut itself and didn't allow people to go Haridwar and have Samuhik Snan, because this collective bath, taking bath in Ganga, can be a major cause of spreading corona amongst all pilgrims who are coming there for Purnima Snan. Chhat Puja in Delhi government didn't allow people to go to ghats. They were requested to do it home. Similarly, many religious activities, social activities are confined within small groups. So either we should be saying no vaccine, no schools, and if we want, there was a situation when I can recall earthquake happened in Gujarat in 2000. There I was working with a non-government organization and trying to help people in the way we can help. So there our organization thought of working on schools and trying to open it as early as possible, because the young children who are at home, who has gone through the Bhuj earthquake trauma, most out of that trauma, and best way of bringing them out of that trauma is to bring them school, to allow them to come to school and play with their friends and get into their academic and co-curricular activities. Now situation is another challenge. It is not allowing us to reopen schools at the earliest. It is saying schools should be last to be reopened when all society, all industry, all economy, all adults, all senior citizens, all corona warriors have been attended to. Then we'll think of reopening schools the way we are planning to allow social events like wedding. 50 people are allowed. Challenges before us, and we need to be very, very sensitive about this issue, because those children are future of the country. We want them to continue their education, but at the same time we want them to grow with healthy mind, healthy aptitude. So their emotion should not be disturbed. Their emotion had already been disturbed during last 10 months. Now when we'll allow them to school, we should be more friendly, extra cautious, reducing curriculum to the best possible way, and evaluating them on the basis of their internal things, on continuous comprehensive evaluation things, and such mechanism can be worked out where more of outdoor activities can be encouraged, so they can, as soon as possible, they should forget this corona period and grow, enjoy, and move forward in their healthy life, which is the life of the nation as well. So for the time being, I would stop here, but towards the end of the session, after my colleague Dr. Jesse Abraham address, if there are few questions from the participants, I would be happy to attend. Over to Dr. Balu for the program. Thank you very much.
Thank you, Professor, for a holistic presentation, and you have given a lot of recommendation for the mental well-being of children in post-COVID-19. And there is a couple of questions for you. One question from Meera Swami: maintaining physical distancing will be really challenging. How do we work out on it?
As I suggested, that maintaining distance would really be a challenge, especially from young people in schools. So we should try to call only those who are bare minimum essential, like I suggested, only class 12 who is exiting school next year. Only those should be allowed, and their school, their classes should be in more open spaces where there is more physical space to maintain social distance. And schools have to gear up with lot of sanitization process, lot of hygiene process, and no student should be compelled. If somebody is not emotionally, socially feeling good to come to school, no, it should be compulsory. It should be only for blended mode is a good option. So people who are attending class or can be a video recorded lesson can be uploaded on school website for others who cannot come to school at this stage. So these ways need to be think of. We do not have any precedent before us because it is unprecedented situation. So we need to work out our own mechanism according to the situation, according to the place we are working in.
Yeah. Thank you, Professor, for an elaborate answer. The next question is, until the corona vaccine is available, opening up schools seems impossible. Then would it not be a fatal for young children to open schools without the availability of vaccines?
To some extent, I am in agreement with this observation. The way I suggested, Government of Delhi is planning to open schools only after vaccination of all children. So such mechanism need to be worked out, and blended model online teaching has already taken shape, already taken place in the country. So that should continue with more open, more means of reaching out to students. But not able to attend to online, only for those few students once a week, sort of 10% students can be allowed to come to school and have a tutorial type of discussion with their teachers. Tutorial type meeting in the school can be planned.
Yeah. Thank you so much, sir. Now let's move on to the next presentation. It's my privilege to welcome Dr. Jesse Abraham, who is a professor of Department of Teachers and Non-Formal Education, Jamia Millia Islamia. Over to you, ma'am.
So, good afternoon, everybody. I'm very happy and I feel honored to be a panelist in your discussion on safety of children when schools reopen, organized by your esteemed institution, National Institute for Distance Management at Mizoram. And I will just put a few points which I think are absolutely important here. Now, when we think about safety of children at home, they are safe. We feel very happy when the children are at home, of course. But the thing is, too much of holidays, too long holidays, and then the students are eager to get back to school, it seems. All students prefer to get back without any delay. And for parents, of course, they prefer to ensure safety. Schools can reopen slowly after the medicine and vaccine are available. That's what they say. In that case, it will take more time, as my friend Professor Arora was saying, and other panelists also felt so. See, and even the UNICEF, even yesterday, there was an article which said there is concern about children's safety as pandemic lingers. It is not going away. When the COVID situation started, we thought it is going for a few days or few weeks or few months. Now the entire year is gone. It is not yet over that way. It is actually lingering on. So how long, that we don't know. And in such a situation, when we recollect back March 11th onwards, March 11th, 2020, WHO declared it as a pandemic, the infection by a novel coronavirus named SARS-CoV-2, severe acute respiratory syndrome coronavirus 2. This can cause a disease named COVID-19. Okay. And we thought it is going to be for a short while, but it is not going. And what is how it gets spread? As you all know, or by this time, it is the droplet released from while talking, coughing, or sneezing by infected people. That is the way it is actually spread. And for this, we need high level of personal hygiene and strict measures of social distancing. That is why all the enterprises, industries, business, and social recreational venues and schools were closed because of this. And then the percentage of children who lack access to education due to pandemic. You know what is the percentage before COVID? Before COVID, only 47% of children were actually affected due to various reasons, not able to attend school due to various things. Now it is all over the world. 56% of children are affected and they are not able to attend school. It seems others, when I say 56, the other half is actually able to attend through some kind of virtual situations as such. But then when we think about the safety in the school, there was a very interesting study by NIMHANS in Delhi on children, school-going children in Delhi, and they found that 90% of the schools do not have any record of injuries that happen in the school. And also 50% of schools only met the safety standards prescribed by the government of India. And also 20% of the schools only had expected fire safety measures. That means accidents are there happening in the school. There are possibilities of fire and other problems, many kind of abuse, etc., are possible in the school. Even before COVID, it was happening. Okay. And the child, when we think about the status of children in India, child mortality rate is not very good, and not even as good as our neighboring countries. And low per capita income of parents are also very harmful for the students' welfare. And students are affected because children are the product of their home, and parents and their education, their occupation affect children. Therefore, even the low adult literacy of parents, unemployment of parents, all these affect children. And children are victims of violence, accidents, everything. And COVID-19 added on to all these of our children. And now we have the online form of education. As I said, some children are not affected to that extent in education scenario. What are those children? Those children are the ones who are making use of the online platform. And see, only 29% of our children attend private school. Rest of them go to government schools. And in the government school and other places where the parents have are not in a position to provide for their education, the devices and the infrastructure, the children feel very frustrated. Some even committed suicide. In Kerala, a girl committed suicide because she couldn't access the program which is provided through the television by the government of Kerala, Victor's channel. Another girl committed suicide, did not have to access the online education. So it actually adds on to the different aspects, agonies of the children. And my co-panelists already discussed about the emotional trauma associated with it. I'm not talking about it now. But when we think about children and COVID-19, in general, children with COVID-19 are less likely to have severe symptoms than adults or experience any an asymptomatic infection, meaning they do not have any signs or symptoms of disease. So children are affected to a lesser extent. An ambitious study of nearly 85,000 of cases in India and published in Journal of Science found that children at virus and spread to others. Offers the children can be affected and children can pass it to others. Are also having the threat of death due to as I meant, but comparatively, the low risk of hospitalization and death among children themselves must be contextualized to the risk posed to the teachers, school administrators, and other staff in school environment. If you open, it is more of a risk for the community as such on the whole. The risk for teachers, school administrators, and other staff is expected to mirror that of other adults in the community if they contract this COVID-19. And also, at least 463 million, about 31% of school children worldwide cannot be reached by digital or broadcast or remote learning programs. This I said earlier. That means there is a need for starting it in phases or providing some kind of educational access to these children. There is a need for that. And also one more important factor, you should be aware that as many as 132 million people may go hungry in 2020 because of COVID, and in that 36 million belong to the children, the age group of under 14. That means children are affected in many ways due to COVID. Therefore, there is a need for schools to reopen, but not in a hurry. But because the government and other authorities have to consider many things, how to make it accessible to the people, that is to be thought of. I think like these kind of webinars help us to think about how can we provide education, nutrition, care, etc. to the needy children. That's what is the question here. When schools are to reopen, we need to take many various measures. These measures have to be followed by school authorities, parents, students, and all others, community members, etc. Why? Because schools are actually providing a safe, supportive learning environment for students. And it is a major employer, employ many teachers and other staff, and also enable parents, guardians, and caregivers to work. You know, they leave the children here in the school and go to work, and they are also affected. They cannot leave their children alone and go. These kind of situations are also arising. And also, these schools actually help us to mitigate health disparities. That is, if there is a school meal program or any other intervention program of the government, it is normally centered around the school. Actually, schools, if it is reopened, it can do many things for the community. That is also another thing. But then the COVID transmission in schools may be a reflection of transmission in the surrounding community. If it is, as Professor Arora was saying, if a particular area is actually having high incidence of COVID, maybe those students who come to the school from that community may also have some kind of infection with them. That is there, a part of the community. Therefore, when taking decision on when to open schools for in-person learning, it is important to understand that SARS-CoV-2 transmission within the surrounding community to determine possible risk of introduction. It is very important for us to cover many aspects. Here we have safety in school. That means safety of students are important, safety of teachers are important, and safety of parents and community members are also important. And what are the considerations for schools? One thing, we have to promote behaviors that reduce COVID-19 spread. It's very important to prevent the spread of the disease. One thing. Second thing is maintaining healthy environments. Third is maintaining healthy operations and preparing for when someone gets sick. So I'm going to explain each of these 4 points in the next few minutes. So when we think about promoting behaviors that reduce the spread of COVID, I think you must have seen many videos about schools that already have reopened, like in Korea. In other places, they have already tried reopening. And I was watching the videos, I found that at the entrance of the school itself, they have the temperature scanner, and they are checking the temperature of all students and staff at the entry. They have sanitizer spray at the entry, which even to the shoes and everything. There is a spray there. And shoes and bags, everything get that spray as such. And there is a separate place for each child. And in Korea, they are providing a plastic sheet around each child in their desk. But what is our problem? We have overcrowded classrooms. We don't have even desks for children to sit. And our children are actually not that, orderly as they enter. So, and also another thing is the face covering or the mask. Masks need to be worn by all children below, about 5 years, and not children below 5 years. And also it has to be worn properly, covering the nose and also the mouth, because as I said earlier, the virus spread through the droplets, like the cough or cold, everything. Similarly, it is spread through droplets. But the problem with COVID is it is more dangerous than such minor things like cold or cough, etc. If you get it, it will go in a matter of 3 or 4 or a week's time. But here, it affects the blood clotting mechanism. It affects other internal organs and it can become fatal. That is the major problem. So we need to actually encourage wearing mask, and the children below 2 years and younger need not wear any mask because they cannot be taught how to wear, etc. And also it can be removed for shorter time while they are eating or drinking, but otherwise they are not supposed to remove this mask in the school. And but one thing, when we say wear the mask and come to the school, there was this article written by somebody in the internet. I was reading yesterday. He sent the child wearing a mask of a Spider-Man and sent the child to the school. When he returned, he had the mask of another mandrake or some other character. It means that the mask in the school. So that is very difficult. And ensure that they are not exchanging masks. We have to take an attempt if we really want children to start coming to the school. The children have to be educated, and the public also should be made aware of providing such things. And another thing is, as somebody else also asked this question, social distance. In other countries, they have actually marked the floor for social distancing. The classroom was reorganized for social distancing. The laboratories, everything was arranged in such a way that there is a gap of 6 feet. 6 feet separation means 3-meter radius. That means 3 from your one side and the other for 3. That makes 6 meter separation is provided to the children, and it is because the droplet cannot actually fly and move farther than that 6 feet. That is what is expected. But then if they are wearing mask and if they are wearing taking all precautions, actually it could actually help to prevent such a thing. And also no common play material should be there, because it is by touch. I said earlier, it is spread because from the nose droplets come to the hand, and if the hand touches on some other material, it can actually be transmitted to other person. Similarly, food item cannot be shared in the school, and each child is to bring their own food. And if provided by the school, like in the case, it has to be provided in the hygienically packed item should be supplied, and the children should be encouraged to wash water before the food and also after the food. And if there is a canteen, there should be separate time for different classes. No overcrowding can be allowed. What they have done is to give different timings for different classes with the they ensure that one class moves on and then there is a disinfection and the next class moves in, like that. Then also another important thing about the classroom is that in the countries where they have opened, they have staggered, they have actually given some kind of shift system there. As Professor Pankaj Arora said, it is in the mixed mode or a hybrid mode or blended mode the schools are functioning. Every time half capacity of the children comes to the school. That means if a class has 40 children, only 20 will come to the school at a particular time, and the rest of the 20 will come on the previous day. And we never allowed to mix the group actually. This 20, which is coming on Monday, will come intact on Wednesday and then on Friday, like that. The Tuesday and Thursday and the Saturday, like that. The group will be coming to the class in half full, and the social distancing in the class is actually to be ensured by these kind of grouping. And another thing, important point, Dr. Santosh Kumar also said about the transportation. I've come across these things that in the foreign countries, they are asking the parents to drop their children themselves. But in India, you know, all these public buses or school buses are the major means of transportation. For that, you know, ensuring space between seats in the school buses, we have to make demarcation. And also parents should see that the children are obeying these things, and a mask should be worn while traveling also. And also sanitizer, it should be used before entering the bus. And also 6 meters distance from the driver is also to be ensured. Seat belt is to be provided in the bus also to restrict movement of the children in the bus. As Dr. Santosh Kumar said, no, when he was a student, kid himself, they used to move around in the bus. So that has to be prevented. And also there should be visual cues to illustrate participants about where to sit, how to behave, etc. Another thing is about sanitization. That means schools will have to invest a lot on sanitization. Parents also will have to provide their own sanitization. Sanitization and washing hands need to be emphasized. A lot of water is required in the school. And we have many schools where there is no water at all. We need to provide water for all these. And also that students should provide their own sanitizer if is possible. And also very important to provide the plastic shield if it is possible. In wherever it is possible, between the desk or between the material of the students, if there is any such thing. And then mitigation strategies to reduce transmission of COVID-19 in schools. Most important thing is hand hygiene and respiratory etiquette. I said earlier, I'm repeating here. Washing hands means about 20 seconds at least they should be washing the hand, covering all areas of the hand. They have to wash it properly, and encourage students and staff to cover their coughs or sneezes, and also wash their hand immediately. And also they should not cough or sneeze publicly. And persons with disability should be given assistance for washing and maintaining hygiene. And there is a need for disinfecting the school premises of our government schools, how safe it is. Otherwise also, you know how clean it is. But then here, coronavirus means prevention of coronavirus infection means you have to maintain cleanliness, washing with soap and water of the surfaces, and also a frequent disinfection of surfaces and objects touched by multiple persons. That's very important. That means students and teachers and parents should be scanned for temperature, I said, maintaining healthy environment. Suppose somebody brings an infection, that person has to be immediately sent back. That's very important. And also maintain record of all persons entering the classroom premises for different work, because there is a thing for tracking the course of infection. If somebody who was a plumber who came to the school and he got COVID, how can we prevent further spread? We should know who all are coming. And if there is any case of COVID among the people who came to the school, and then we should be reported and we should take necessary action. Actually, we should restrict unnecessary visitors. The school premise should be kept clean and sanitized and disinfected. All common spaces like door handle, railing of stairs, etc., should be sanitized. All rooms should be ventilated. Another thing is, in India's many places is that we don't have such good ventilation, cross ventilation, etc. The COVID guidelines are saying that we should not actually have stuffy rooms. We should open up windows, allow wind to move. Even Professor Arora said we should go for open air, plays and other things. Even open air classes is possible if the climate is supporting. And also another healthy operation, when we think about healthy operation, we should think about distributing the materials required for the classroom and also for washing areas, and provide awareness program to parents and members. We have to invite doctors and other health workers to advise or to answer to the doubts of the parents, and provide awareness regarding use of mask, avoiding touching each other, and even touching the mask while using. Many people are I have seen many people touching their mask often. It is not correct. And also removing the mask and keeping it on the chin, it is also not correct. We should know how to wear it and what kind of material, how to wash and maintain it. That should be educated to all people. And also we should discourage sharing of material. Though sharing of material is a very good thing practice, but we here due to COVID, we cannot actually share material with anyone. And also we should encourage hybrid mode with those who are sick or in quarantine attending the school online mode. So that means school will be functioning on a face-to-face mode, but then those who opt for online mode can always take it up. That's a best way. As it was said earlier, it should not be very compulsory or strict attendance. That way we should avoid allow people to online classes also. And also preparing for when someone gets sick. Suppose somebody in the class gets sick, what should we do? Prepare a plan of action for tackling the situation if a student or staff gets COVID, and make everyone aware of reporting where they should report everything, and also about COVID hospitals around and the procedures for quarantine and prevention of spreading of the disease. And schools should report to the authorities about any COVID incidents in the school. And those students and staff who was in the school of the in the class of the afflicted person should also go for quarantine. And if there is no symptom, even after 7 days, they can actually resume their work. That means often sometimes the class may go online in between also if there is a need. And the action plan for reopening should be made with the help of awareness from all stakeholders. We cannot just start tomorrow. We cannot announce and restart like the COVID lockdown was announced all of a sudden on a particular day. Like that, we cannot actually restart the school. We have to have an awareness program. We have a preparedness month where people have to be sensitized for and getting the infrastructure ready. We have to have monitoring rules and regulations ready. We have to mark for social distancing, and we have to provide instruction to the school canteen and the school cleanliness workers and everybody. And also we need to prepare a profile generation of all those people who have already contracted the disease, and all those households where there was any case of COVID, we should know and then act accordingly. It is not for separating or isolating anybody, but we should know who are the people who already have had this exposure and who are the people who are actually more at risk, etc. And also the government on their part should prepare district-wise plan and provide for the different required support economically and the technical know-how and the socio-economical context. And maybe even public-private partnerships can be solicited for this, because additional funds may be required for arrangements, which I was mentioning. And the teacher-student ratio in the RT Act actually has made it as 1:30 and 1:40. But many of the schools actually are not following. As I said earlier, when I was talking about social distancing, half the class should come. If there is a classroom meant for 40 children and if you have 60 children, then half means 30. Even that will be not adequately social distancing, but still we can think about how we can get it done. We have to think about it and plan for achieving those RTE recommendations regarding teacher-student ratio. In this regard, I would like to say, even the daycare and all, not for small children, should be reopened. Along with the school, we will have to reopen them even because the parents may have to go back to their work. So when we are reopening such places in the US and other countries, 1:4 is the ratio there. You know what is the ratio in India? 1:15 or 1:20, So we need to actually have more staff employed for giving these kind of ratios, these kind of spread out in the institutions. We need to actually revise what kind of norms can be followed there. And the Operation Digital Board, which the government had already announced to integrate technology into teaching and learning, should be given priority. Free Wi-Fi should be provided, free or otherwise subsidized devices like laptops and tablets, etc., should be provided to the students through public-private partnerships. Earlier, government of UP, I think, provided laptops to school children. Jayalalitha government in Tamil Nadu provided laptops to school children. And now that was not the time. This is the time to provide all these devices to the people if they are actually serious about digitalization and the school education as such. So I think we can actually think about an action plan, and we can actually attain many things with the help of Okola by the cooperation of noble-hearted, benevolent people in the community. And also midday meal program. You know how much how some people are dependent on the midday meal program. It actually has to be resumed. I'm glad that the Delhi government already had announced resuming the food material supply for children. Actually, they should be resuming it, but then with caution. They have to be educated about safe handling, and also any teacher in school gets afflicted, they should be given a provision of working from home in amidst this COVID, because they also are exposed to these kind of situations. That means maybe we need more people, more hands to work in the schools again. And also we need a government support the parents who cannot afford the fees or any such and then we have I'm coming to the conclusion. So it is critical for schools to open as safely as quickly. That's very important thing, but it is dependent upon many factors. How safe is the place? How much of preparedness is there on the part of the school, on the part of the authorities? That has to be taken into consideration. And also we need to actually educate and make everybody support the reopening in a stage by stage process if the COVID-19 is going to linger on for more time in 2020. Right from March onwards, we are having online classes. And how long more we have to have online classes? We are not certain. And such a situation, we can prioritize on a stage-by-stage basis. As Professor Pankaj Arora sir said, maybe the 12th standard is allowed first or something, and then other classes and slowly and so on. But then only at a 50% strength or some kind of situation here will have to be worked on, and a kind of blended mode has to be advised. And what are the guidelines for making all these things work? We need to actually work on it further. And refer to many such thing. I found that the CDC, that is the Center for COVID Management Center of US, have actually provided some guidelines. We can actually refer to that, though US is not managing so well, but we can always see what they are doing. And one thing which I appreciate wholeheartedly is that Narendra Modi ji, our Prime Minister, announced this lockdown without delay and allowed all schools and colleges to go on this lockdown and swift to the online mode. That is why we could contain the spread of the disease to this extent at least. We don't have as many ICUs and other hospitals to support many people who may need vital health support system if it was not in place. So thanks to the government for the lockdown. And if the lockdown is eased, it has to be done with precautions, adhering to all the different guidelines. We can refer to many guidelines available and what we can do with the present setup that we have to. I am not advising immediate next day reopening, but reopening in stages with the strict guidelines about wearing of mask, about wearing many. Even I didn't mention about the PPE. Actually, mask is not a personal protection equipment. It is mask is for preventing the spread of the disease. Suppose one person is having COVID and he or she does not know that he or she has the infecting germ inside her. When she talks, when she sneezes, that disease spreading germs will not reach the other person. That is why we are wearing the mask. And that way we are preventing the spread of the disease. And when we are not actually wearing the mask, the other person who sneezed inadvertently without knowing that he is having any disease producing germ will inflict us. We will get infected. Therefore, mask is very important. Washing hand is very important. We have to educate our students and our parents about this. Many of our students, many of our parents are so ignorant about the need for such small measures which could do a great saving for them and also for the country as such. And with this, I stop here. You can ask me any doubt if you have about whatever I have spoken.
Thank you so much, Professor, for your wonderful presentation. And you have seen how the children were being affected due to this COVID-19 and what are the practical issues involved in protecting children from infection of COVID-19. And you also said some of the precautions to be taken by the schools, like disinfecting all the belongings of school children before enter into the school, and how the children need to be brought to the school by different measures, and we also need to take care during their transport. Like I've given a lot of recommendations. Thank you so much. We have a couple of questions for you, ma'am. Let me read it out. A question raised by Adira. If you are letting the students to play as they have been long deprived, how is social distancing possible?
Okay. Actually, what can be done is we can have before entering the playground, everybody has to be using some kind of sanitizer. And if there is any play equipment like a ball or something, that also has to be disinfected, and the playground has to be disinfected. And those students, I said earlier also, there is no mixing of groups. We will make that group as a permanent kind of a group which will be meeting in the ground. That means, suppose there were 40 students in a class, 20 were allowed to come on a particular day, and they have a sports period. And then suppose the students are divided into two groups, 10 students are in one group, the other 10 in the other group. Every day they have to keep the same group as such, so that at least there is no mixing of the group, and that much of precaution we can take actually. And in the guidelines abroad, they have given that if that is not possible, do not allow the games period or games now when we start. Because unless and until you are able to disinfect the field, disinfect the hands of the people, and we can ensure that there is no such spread or cross mingling of the children, we cannot have games activity in the school. But if it is taken care of, then we can have activity. Otherwise, we can sit in a group and have many, like Andashari hai na? Any such mental games or quizzes. Such activity can be given as a game, as a play material. Enacting a drama. All these are actually without touching. You can do.
Thank you, Professor, for elaborating your answer. There is one more question. There was a recent news about Haryana schools where the schools are open, but it leads to spread of this virus at a higher pace. In such scenario, how we are justifying the reopening of schools?
That is why I said earlier, if you had listened to my lecture, I said, like the announcement of the pandemic on a particular day, 22nd March, I think they said it is going to be a lockdown. Like that, all of a sudden, you cannot reopen the school. We need to first have a preparedness month where we will prepare the school premises, prepare all the stakeholders, get all the equipments in place, and then slowly, phase by phase, you will start with the senior children first. And then gradually all school 50% strength. On any day, it will be 50% of the school which will be functioning. Like that, you have to take a space for social distancing. All kinds of precautions have to be taken, which should be in place. Is it possible in India? That's what the question is. Others are trying like this.
Thank you, ma'am. Your last question, it's to general question. A number of sanitizers are available in the market. Which one is advisable?
No, I actually cannot say which one is better. We all go for some brands like Dettol or some already well-known brands, but you can always read whether it has about 70+% of alcohol, ethanol, ethyl alcohol or something. If it is there, it is supposed to be safe. And another thing is, there were so many people who said we can make these things at home only from soap solution, etc. Actually, if you prepare soap solution and use it for washing the floor or hands, etc., even that is a good disinfecting agent. The good soap should be okay. We should not be going for brands, but there are so many brands which are already there. We can always check whether they are active or not. But actually, government schools will be following the guidelines by the government of India. Guideline which they will be following. Whatever is the most economical one, they will be getting. In our college, they are getting some government recommended material. I didn't go look into that. They have this purchasing department which actually is taking care of that.
Yeah. Thank you so much, ma'am. We are running out of the time. It's a time to wind up our program. Professor Lalmasai, do you have any points to add here in this program now? Professor Lalmasai? You want to say anything here now?
Okay. I don't have much to say since you are the host. Okay, the rest will be in your hands. Okay. I don't have anything to say since you are the host. Okay, you can take.
Yeah. Thank you, Professor.
Yeah. The rest of the thing will be in your hands. Giving certificates, everything will be in your hands.
Yes. Yeah, thank you. So it was we had two good presentations from two eminent speakers, and they have shared a lot of practical recommendations which we need to implement to safeguard our children after reopening of the schools. Especially the first speaker have shared about the mental well-being or mental health of the children, how we are going to ensure it, and basically during this past 8 months period, the children were addicted to the screens. So he has given certain recommendations in the schools to be implemented to overcome from the screen addiction. And from the second speaker, we have seen certain good ideas to safely reopen the schools and what are the precautions to be taken by the schools. So these will help us to ensure how we are going to ensure the safety of children after this reopening of school. And in addition to that, we also need to ensure that the standard operating procedure issued by Ministry of Education need to be implemented by all the schools and educational institutions, so that we can ensure the safety of the children when we reopen the schools at this COVID-19 situation. Right. So with this, let us come to a conclusion of this program. Now, on behalf of NIDM Child-Centered Disaster.
Dr. Balu.
Yes, sir. Yes, sir. Welcome, sir. You are.
Just wait. Two questions which need to be answered.
Yes, sir.
That question is coming on this: how to stop the behavior of the children when the joy. You remember? You can see that question. The joy of the children when they will the school will open and they will come and they will reach there. Children are very expressive, no? So that's what the delegates are raising this question. So how to manage their emotions, those emotions of joy when the school will be open? Are you able to listen to me?
Yes, sir. I am listening to you, sir.
Could you see?
I'm just searching that. I'm searching in the chat box. The college medical school.
See the last question, second last question. Anyway, that question is there.
Yes.
So the important is to what CCDRR can think of about that question, how that to be answered. And second, they are asking about this constant monitoring, that who is going to monitor the behavior, and also that whether the guidelines are being implemented in toto or not. So,
Okay.
so these two questions, let me respond. And I'm not commenting on that question which came on that which quality of sanitizer would be better.
Okay.
So that I'm not telling anything. Better to depend less on the sanitizers and more work for the hand washing and hand washing with the soaps. So probably that would prevent even that quality is affecting us in terms of even the adults. Even if myself using that kind of a sanitizer which have been provided by the office, and whatever the office is bringing in, also bringing from the vendors. So, and then we find that after using for 6 months or 7 months, your hands have got burned and skins are put into bad shape. And so that is why I will really not recommend to use any of kind of sanitizer which is not giving, because in India we are very famous in producing spurious things.
Yes.
In order to earn very fast money, wants to become richer in 10 days of time or 20 days of time. Initially, when this sanitizer business came into as a kind of a need for the entire population. Earlier, it was confined to largely to the hospital, and very few citizens were using on a daily basis, and for every 20 minutes they were using. But now this is multiplied manifold. It is available all over, the same way as the mask is available all over. Every pancharwala, every they are making mask, and darji, and they are doing this. So I'm not sure about the quality. So that is why I'm saying NIDM doesn't recommend that you should do 2 or 3 kinds of thing. So since the quality control is not there, and nobody is saying also that authority that X or Y or Z are the best sanitizer to be used by checking this, like FSSI, they give kind of a credit to foodstuffs. So same way we have the regulatory authority, they should also get pumped into this kind of giving this information to the people that what kind of sanitizers are relied upon, to be relied upon. Everybody we are using, even we are taking the campaign of this appropriate behavior of COVID-19. So appropriate behavior is one of the behavior is this washing hands and also using washing hand and sanitizing your hands. So the question gentleman has asked about that which quality of sanitizer would be used. Uh, I would suggest as long as you can avoid, that is the best thing, and you use the soap which is known soaps, and that can be applied upon. Otherwise, you will realize the same. You will be in the same boat in which I am today. So with the burnt skin and problems, that is why I have. The second thing which I would like to mention about this control of the children's emotions. That is very tricky question and very important to look at all the people who are engaged into welcoming children, and government guidelines are there to open the schools. So that is going to be very crucial, and that is why this what Dr. Balu said in the beginning itself, that many of the schools are reported positive cases after opening it. So that has to be brought in, some arrangements to be done. Like you can't monitor most of them, but if you can monitor even their temperature and other thing, and once the entry is ensured that those who are entering in the school are not positive. So if that is when the risk is reduced, and with that reduced risk, I'm not saying zero risk. So with the reduced risk, they can meet, and even if they are they forget and momentary expression that they come together. That is also good. That let the expression come out. Probably preventing those emotions would create another problem for the children. So that is to be seen, that how we can ensure that once they are entering, they are maintaining hygiene, and also the temperature is not there. Whatever the available kind of indicators for taking positive cases. So that is one. So that joy can be handled by them, but the children's behavior after 6 months, that bound to be happen. And if you put any regulatory system on that not to do that, then probably it will not serve the purpose. So we have to be kind of have a much more pragmatic and also careful. I'm not saying that we should allow and then let the this spread. What I'm saying is to first check all those children who are entering into the school, and initial joy, if it is coming, although the children are now very smart, they are being educated by their parents, and also they have been practicing all the COVID appropriate behavior at home. So some learning has already gone into them. So requesting them, probably that would also work. And the last question, the monitoring. The monitoring probably should be done by the authorities. Principal should make a team. Normally, many of the schools, and somebody was suggesting that we could start with the senior students and then later in the open area. And again, that it's a good suggestion which has come up. And how those children, elder one given responsibility to regulate the behavior of the smaller one. So they should be optimized. Their presence in the school to be optimized for maintaining the hygienic environment, which can prevent COVID-19. Other than the authorities, and so other than the authorities, they would be a very good source for the, because they also have to be kept in the safer conditions, and also that younger children. So these are the couple of suggestions which I thought which has emerged and very nicely maintained by Madam Jessie Abraham, and also our friend from Delhi, Professor Prashant, or what? Prashant, no?
Mr.
So,
Dr. Pankaj.
Mr. Pankaj Arora, no? Yeah. Dr. Pankaj Arora. So I'm really grateful that kind of suggestions they brought in. So I would request Balaji to pen down those suggestions, and we can send it to the guidelines. You match with the guidelines which have been issued by the Government of India,
Definitely.
and where it is missing those recommendations which are coming on a regular basis. So that's what somebody was suggesting, that social psycho care would be needed. Sexual violence is there. They were trapped into jail kind of atmosphere. So like even you see that adults are coming and going to the market or Diwali purchase and all. The children have seen those images. It's not that they are full sitting in the household and not looking at the television. So they are also looking at television and seeing that how our older generations are behaving irresponsible. So that images also get imprinted. So there's a mixed match. Our media should also show those things which are actually positive in terms of that we're adhering, and not adhering also. I'm not saying that they should not show, but enforcement is very, very important. And education department of the government should make a kind of a more mission or checking how the schools are, as the traffic police are doing at the traffic, that whether anyone is wearing mask or not, and putting fine. And same way that education department can do initial some policing. I'm not saying that some policing in just regulating behavior initially, mild behavior. It's not that they should just control that. And but school are not having that much of resources, heterogeneity. So all schools should also be provided and strengthen their capacity for receiving children. That is also needed. A education department does not be given directions that these should be followed, but they should be capacitated enough so that they can also play important role in the entire endeavor. Thank you. Bye.
Thank you so much, Professor, for enriching the webinar with your valuable points. With your permission, shall we go for the vote of thanks? If any points need to be shared by other dignitaries, you are most welcome before the vote of thanks. Professor Jesse Abraham or Professor Lal Masai or Professor Pankaj Arora, do you have any points to add here? Okay. Professor Santosh sir, can I move to vote of thanks?
Yeah, please go ahead.
Yeah, thank you so much, sir. So as Professor Santosh sir has also given a lot of recommendation, as he suggests, definitely we will include all the recommendations given by the eminent speakers that we will forward to the Minister of Education. And with this, now it's my privilege to propose a vote of thanks on behalf of NIDM CCDRR Center. I convey my sincere gratitude to the Executive Director Manoj Kumar Bindal sir, National Institute of Disaster Management, and Professor Santosh Kumar sir for giving his valuable time, even in his busy schedule. And since the whole program he has participated, and he has also shared a lot of valuable points. And I also convey my sincere gratitude to the both the speaker, Professor Jesse Abraham and Professor Pankaj Arora, and also my sincere thanks to Professor Lal Masai for coordinating from Central University of Mizoram to make this webinar as wonderful. And finally, my sincere thanks to all the participants for participating in this webinar. We have shared the feedback link you can share. The certificate will be issued within 15 days, and those who are having minimum 80% of attendance, you will be receiving a certificate through your mail. Thank you so much to everyone. Thanks. Let me end the meeting.